Hey everyone, it's Stuart here from Health by Science. I'm one of the physios, and might be a bit weird seeing a guy doing a presentation on menopause. What do I know? Well, I knew very little, and that was really the problem. In the majority of our clients and patients are females, and we know for a fact that a lot of people will be going through some struggles. And if we don't understand it, it makes it harder to sympathise and help. Really, there's a lot to learn at uni when you're doing physiotherapy. There's a lot to learn any course related to a health industry profession, but this is a massive area that is not really spoken about much. So this is the purpose of this workshop. So without further ado, let's get stuck into it. So the aim of the session is to learn about menopause and to understand how we can improve our services. So you might be thinking, why? Good question. Like I said before, 52% of the population and our clients and patients are female. So if we understand it, then we're doing them a disservice. So number one, it remains really poorly recognised at work and in the health industries that we offer. It's a massive taboo subject. Even a lot of women don't speak about it amongst each other. So it's important we try and normalise conversation. And like I said before, a lot of health professionals and even the medical professions didn't get taught a lot about menopause or how to address the issues most effectively. It's also really under-researched, given how prevalent it is and how predictable it is as well. There isn't a lot of research, unfortunately. And there's insufficient knowledge within the whole community in healthcare, really, and amongst society. So that's what we are here to help improve. So again, why is this important? How does it impact people? Well, we are all about helping people create and sustain health habits, and it makes it much harder to do that. If sleep is harder, if you're getting brain fog, etc., it just makes that harder. So we need to try and work with that and try and strategize. People often have a heightened sensitivity to pain. Hormones fluctuating pain is very complex, and hormones play a big part of that. It impacts quality of work and productivity. That impacts work life, home life, everything. It can reduce the ability to learn new tasks, paying attention because of poor memory and brain fog. There's a massive increase in absenteeism and presenteeism. Presenteeism is people that are going to work when they shouldn't, because they'd be better off having a rest, coming back and being way more productive when they're feeling better. And we know that about 4 million workdays were lost in the UK in 2018. So there's a big cost to this in the UK from an economical perspective. So the more we can talk about it, the more we can understand it, help improve the symptoms, etc., the better everyone will be. So what is menopause? Well, it's a normal physiological transition in women, and it's defined as the end of female reproductive function. So menopause actually has a very precise meaning. It's the point in time that's identified retrospectively when a woman hasn't had a menstrual bleed for 12 months. So they could go 11 months without a period, thinking they're going through menopause, thinking they're perimenopausal, then they have the period in their 12th month, and actually, technically, you've not gone through menopause. So it varies from person to person, but that technically is the definition of menopause, when you haven't had a bleed, haven't had a period in 12 months. So it's preceded by perimenopause. So as people don't have the periods, it would signify that they're perimenopausal, and you might hear clients talk about that quite a lot. So that's what that means. And it's triggered by the fluctuation of two key hormones, estrogen and progesterone. So when females in their fertility years, estrogen and progesterone are both a kind of stable, high level. Then over time, progesterone decreases and estrogen kind of fluctuates quite a lot. So as you can see, as towards the end of the fertility years, progesterone does come down, and it continues to go down into menopause. But during the perimenopausal period, estrogen's all over the place. It can go up and down, and it's not the same from one person to the other. It's very variable. What we do know is that progesterone goes down, but estrogen can go up or down. And that's really what HRT, hormone replacement therapy, aims to kind of help with, is help with symptoms by adjusting those levels of hormones artificially. And we'll come on to that later on. So historically, obviously we've known about menopause for a long time, but the understanding has changed a lot. So it was in 1710 that menopause was defined as a disease. Sorry, historically, medicine has defined women as deformed males who, after menopause, finally became more like the male ideal. It was in 1710 that menopause officially became defined as a disease and the worst calamities to beset the female sex. In the 1800s, they started they just came up with some treatment cures to help. And this included leeches on the genitalia and cervix. It doesn't sound very pleasant. Cold water to the abdomen, arsenic even. It's basically poisoning people. Sitting in a hot room to sweat more was another way they would try and help treat. Basically, they didn't have a clue what was going on. So they tried anything to help. But luckily, now we know a little bit more, and there are more effective solutions. Looking back at history again, here are some reasons for admission to hospital for women between the years of 1864 and 1889 in the UK. And as you can see, there are some pretty mental reasons for admission. The war was one, politics, opium habit, literally everything. But as you can see, they're pretty ridiculous. Anything really you can get admitted to hospital for. So they didn't really know why people felt a certain way, and luckily science and medicine has come a long way since those days. So if we look at some statistics, we know that 51% of the population experience menopause because they are female. Menopause can impact women differently depending on their race, religion, and other health inequalities. So, for example, Chinese and Japanese women typically experience longer menstrual cycles than Caucasian women during the menopause transition. Afro-Caribbean and Hispanic women have fewer ovulatory cycles in the last year before final menstrual period compared to women of other races. And we know that women from disadvantaged social circumstances are more likely to suffer from poor health than advantaged women. They're also more likely to reach menopause earlier and to undergo a hysterectomy, to suffer symptoms at menopause, and to have different patterns of HRT or hormone replacement therapy use. So everyone goes through a little bit differently. It's important to understand those like contextual factors, but it's also important to understand that menopause is a normal part of the aging process and it's natural transition affecting all women. It typically affects most women between the ages of 45 and 55, with the average onset being 51. But remember, it is highly variable within that. You can get some people that have early onset menopause, about 1 in 100, and this is normally pharmacological or a surgical intervention to induce menopause. So, for example, removing the ovaries, if someone has cancer, that might be induced menopause. And it typically lasts between 2 and 10 years. So, this is where you have to take each case as it comes and try to understand the person, because there's no recipe for it. Everyone's a little bit different. So in terms of the symptoms, most symptoms are kind of mild to moderate and experienced by 75% of women, but 25% of women do experience more severe symptoms, which is a big old chunk of people. Approximately 1% of women will experience early menopause before the age of 40. So it can happen at any age really. And many women enter the menopause at the peak of their productive lives. So if you think about people that are focused on their career, they might be peaking at about 50 in terms of their productivity and their kind of role in society, whatever that is. It's not ideal to be going through menopause, which is can make this a bit more challenging. So again, it's just very important to bear that in mind. Even high performers will still be going through this as well. So ultimately, it's about, as PTs, physios, and massage therapists, we need to support and understand this, because that can make a massive difference to how women deal with menopause. So, what are the symptoms? The most commonly reported physical symptoms is hot flushes, night sweat, sleep disturbance, joint pain, osteoporosis. And you can also experience cardiovascular disorders as well with menopause. So, hot flushes deserve a special mention because they're so common amongst women going through both peri and menopause and post-menopause. They're a common feature of abrupt menopause due to surgery and treatment with certain medications such as chemotherapy. And they come on rapidly and they can last between 1 to 5 minutes. I remember you have clients that joke, "Oh, it's really hot in here, isn't it?" And you think, "I'm bloody freezing." But as time goes by, you start to realize what they're talking about. And yeah, that's the sort of cues you might look out for when trying to think about which clients might be able to support with this. So it can range from over the course of a week or up to 10 or more in the daytime or nighttime. So again, really variable, but they come on quickly and they last a decent period of time. They can range from severity, from just feeling a bit warm to being like a raging fire from the inside out. And a major hot flush can induce facial and upper body flushing, sweating, and sometimes confusion. But it can also be followed by a sudden chill. So what it's caused by is basically hormones, progesterone and estrogen going a bit AWOL, basically. So the problem, the reason it affects sleep so much is because when our body gets ready to sleep, our body temperature falls in the evening, and this helps us to fall asleep and stay asleep. We sleep better in cool rooms, and the body temperature rises in the morning in preparation for wakefulness. So hot flushes disrupt all of this, which is why it can be really disruptive for sleep. And as we know, sleep is absolutely key for feeling and performing at our best and maintaining a healthy weight. So again, think about someone in the gym already quite hot, but then they get a hot flush. They can also get it in the evening, which is going to make it much, much harder to sustain health habits. And some women report it can make them feel visible, vulnerable. That's what they often try and banter about it, to try and, acknowledge it. Even if as a PT or physio or massage therapist, you might not actually notice. Dynamically, they feel like they're bright red, but they're not. But they feel it. And it's a bit like doing a presentation. If you stood up and you feel your legs and arms shaking, you feel like you're getting red, no one actually notices that at all. But it can be very unnerving and makes you feel very self-conscious. And this can go on for years. So, you might react differently to different people, but if you can understand it and be there if the conversation comes up, make people feel at ease, then obviously that can, improve hormones even in the short term, and at least make people feel calmer, more relaxed, which can help at least make them feel better. The good thing is that although, progesterone and estrogen changing is something that we, can't control very well unless you do HRT, there are still some things very much within our control that we can do to help with sleep. And that includes good quality sleep habits, sleep quality, so turning down the central heating, having a cool room, about 70 degrees Celsius is ideal. Using a fan is another way to make sure that we're staying cool. Pre-bedtime routine, not binging on Netflix. These are all things that will help with sleep and sleep quality. So that if you do have a hot flush or a night sweat, it's not going to affect you as much as it would have done if you were doing those poor health habits as well. Stress is obviously another one. So, for example, massage can be a great stress reliever. Going out for a walk. It's really personable, this one. What helps one person de-stress might not work for another, but understanding yourself and then what you need to do to chill out. And that might just be working with a physio or PT who makes you feel at ease, who feel like you can talk to about this stuff. That can help de-stress you as well. So, but doing things, what we call active recovery, might be yoga, things that are going to help you relax and de-stress, can help with symptoms as well. Movement, obviously. So 7,500 steps a day. It's the same recommendations if you're going for perimenopause, postmenopause, or just gone through the menopause. The same recommendations apply. Now, you might feel a bit more self-conscious about walking or doing exercise because you feel like you're going to go red, but actually it helps. It can really help your body regulate its temperature. It helps your body regulate hormones, etc., which just makes everything improve. So we all need to do strength training. Even more important if you're going through menopause, because your risk of osteoporosis is much higher, which means your bones are a bit brittle. We know that strength training is amazing for bone mineral density and reducing the risk of bone breakages from osteoporosis. Also helps preserve muscle mass. It's just great for everything. So although you might shy away from doing exercises like strength training because you think it's for other people, no, it's more important than ever to do strength training if you're going through menopause or perimenopause or even postmenopause. Regular exercise, cardio, get the heart rate up. Again, you might feel hot, sweaty, a bit paranoid. Again, working with a personal trainer can help you feel at ease. And can help you pick the right intensity so that you feel in control and you're at an intensity level that's suitable for you. You don't need to, go flat out, but you do need to get the heart rate up a little bit. So cardio is definitely a good thing to do. And nutrition. So sometimes there is no correlation. Sorry, there is a correlation between weight gain and age, but it's nothing to do with metabolism. Menopause there's no reason why you can't be a healthy weight and be perimenopausal or postmenopausal. So there are indirect effects. If your sleep is poor, if you're more emotional, for example, if you're struggling with the symptoms and it's just a lot, emotional eating can come into it and poor health habits can develop, which can lead to weight gain. But it's not the hormones, it's not a slow down metabolism that is causing this. That's more of the other indirect effect. So that's good news. Or if you felt like you have put on weight, haven't gone through menopause, the good news is that don't worry, it's not a foregone conclusion. It's not like it's not physiologically determined. You can change it. You can lose weight. And you can maintain a healthy weight through improving health habits. And that should be reassuring. So hopefully you take that as more optimistic rather than pessimistic. There are also certain foods that we need to be mindful of. So spicy food, caffeine, alcohol, that can exacerbate hot flushes as well. So being mindful of those as well and just reflect on how they affect you is really important. Obviously, no caffeine after 2 p.m. because that will disrupt your sleep quality as well, which again can make sleep even worse if you then have night sweats. And alcohol isn't going to help before bed either. So just to summarize those 4 key pillars of health: sleep, stress, movement, nutrition. Physios, PTs, massage therapists, they can all help with those areas. And if you can improve the health habits in those areas, it's gonna make the symptoms better and at least help give yourself the best chance of navigating menopause as best you can. As we say, your genes are like a loaded gun, but it's your lifestyle that can pull the trigger. There are things we can control, and if you focus on that, then that can help psychologically, but also physiologically. And as PTs, physios, and massage therapists, we really need to try and make sure we help people with these health habits, but maybe sell it in a way that is person-centered. So why is it important to focus on sleep quality? Why is it important not to have caffeine after 2 p.m? We can say that, well, because if you do have a night sweat, it's going to make sleep even worse, and it's going to help us to lose weight if we can improve sleep, etc., etc. So understanding the person, the problems they're going through, helps us sell health habits, which is ultimately our job. In terms of psychological symptoms, we've got mood disorders, depression, concentrating, memory. People get brain fog and they forget, they become irritable, and maybe quite anxious. All quite normal, all part of, unfortunately, the kind of hormone fluctuations. So a decline in memory at onset of menopause is quite common, but it does rebound later. And this is due to the effects of low estrogen on nerves in the brain, particularly in the amygdala and the hippocampus. So these are the areas that are associated with mood and memory. So we know that estrogen affects the amygdala and the hippocampus, and that's why it can affect mood and irritability, etc. And that's why it can affect kind of mood and memory, but it does bounce back. So you're going to be really aware when your memory and mood is maybe quite poor, but as those hormones settle down, we know that they recover and you can still perform at a high level. So yeah, just to clarify that, the reason you experience these psychological issues is you basically hijacking the amygdala. This is the really old primitive part of the brain that's associated with fear, aggression, anxiety, the kind of fight or flight. And our brains have evolved to kind of have better control over it, but this is a learned skill, a bit like, elephant rider analogy you might have heard of, or the chimp paradox. It's a whole other topic. But anyway, if we can learn to help be mindful of our emotional side through things like mindfulness, for example, that can help as well. But even just understanding that the reason you experience these symptoms is because of low estrogen, and that leads to poor emotional control, can help you understand it, empathize with it, and work with it, rather than thinking that this is just life that you have to deal with from now on. It's normally short term, and there are things you can do to improve it as well. So what about HRT? Well, HRT can result in a 77% reduction in hot flushes and can directly improve quality of sleep. So it's definitely something you should speak to the doctor or pharmacist about, because a lot of people have really good outcomes with them. Not everybody, 77% is not 100%. So again, there's no kind of golden bullet for this, but it's worth looking at as well. And antidepressants as well might help with some people. So it's worth exploring these options because, nobody wants to take medication unless they need it, but it can really help some people. So it's definitely worth looking into and seeing if it's something you can help with. And ultimately, like we said before, they work by helping to regulate the fluctuations in hormones, estrogen and progesterone, that are responsible for the changes that you're going through. So HRT isn't suitable for everyone, like we said, due to medical or personal reasons, but it's worth considering. And it's interesting that women who take HRT seem to live longer and have healthier lives than those that don't. That doesn't mean that if you don't take HRT, you're going to die young and not be healthy. That's not what we're saying. It's a correlational thing that the research shows. But what we're saying is you shouldn't be afraid of HRT just because it's medication, or even if you've maybe tried it in the past, it hasn't worked. It's worth exploring because there's a lot you can gain from it. So that's a massive win for science and the medical profession. So like we spoke about earlier, a lot of women believe that taking HRT will make them put on weight. There's no evidence to support this. So again, people might put on weight when they take HRT, when they're going through menopause, but this is normally indirect effects of not moving as much because you feel self-conscious, poorer eating habits because emotionally it's tough, and poorer sleep, which can also exacerbate things as well. So you should be reassured that it's not a foregone conclusion. There are things you can do, but also don't beat yourself up if you have put on weight going through menopause and when you're doing HRT, because it's completely understandable as it's very tough. So like any medicine, there are side effects. These usually improve over time. And a general consensus is you should try and persevere for about 3 months if possible, but speak to GP, pharmacist, if they continue for longer, and just keep in regular contact with them if you're struggling. So to clarify, your brain and emotions are not doomed. HRT can help, and there's a lot of positive stories, but if that doesn't work for you, don't worry. Mindfulness, talking therapies, counseling, for example, can be really good ways to help manage your emotions, especially when they become quite heightened and you're finding it hard to regulate them. And the good old lifestyle habits of, good exercise, nutrition, sleep, and stress habits just help maximize your chances of going through it in a positive way. So then that's where, as health professionals, we are worth weight in gold. Some people don't like the analogy of medicine being like exercise, nutrition, but it is like, if you could package the benefits of exercise, nutrition, sleep, and stress into a pill, there wouldn't be a medication that would ever come close. It's so beneficial for you, but it's hard to develop the habits in order to sustain it. So exercise, nutrition, sleep, and stress are non-negotiables for everybody. How you do it is very negotiable and needs to be person-centered, and that's where a coach can come in and help. But they're non-negotiable. We have to work towards improving them. And even if there's a small improvement, for example, going from doing no exercise to 5 minutes a day, has a massive impact on psychological and physiological symptoms and health as well. So mindset also matters massively. So really good book on The Secret Power of Menopause, which, reconceptualizes it, looking at fertility, which typically ends in a woman's mid-40s, occupies less than half of her adult life. And then if she's lucky, she has 30 or 40 years in which to do something else. So reframing it can help. Again, that's why talking therapies, mindfulness, etc., can have a big impact. But from a personal training, physio, massage therapist perspective, it's always worth remembering that it's not about the nail.
It's just, there's all this pressure, And sometimes it feels like it's right up on me, and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I'll bet if we got that out of there...
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing...
You always do this. You always try to fix things when what I really need is for you to just listen.
Yeah, see, I don't think that is what you need. I think what you need is to get the nail
See, you're
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just... Sometimes it's like there's this achy... I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. All of them.
Yeah, that sounds really hard.
It is. Thank you. Ow!
Oh, come on. Ow. If you would just...
Don't...
Try to see things my way.
So, as a guy, there's no way I'm ever going to empathise with anyone going through menopause, because I'm never going to go through it. But I can sympathise. And so the fact that guys will always work with a lot of female clients, it's really important that we understand and able to listen to what people are going through and sympathise with that in a person-centered way. Because people don't care how much you know until they know how much you care. It's always worth remembering that. So making it person-centered also means that we get better results more efficiently and more sustainably. So listening to people is absolutely key. And the way we do that is active listening. So listening is more than just hearing. Listening means you're actively engaged. So you're not just waiting to talk. It's a skill that is really valuable in all walks of life, whether you're friends, family members, but especially important as a health professional to really help people understand themselves, even what they're going through, but also for you to understand what they're going through and then help them decide what they want to do to improve it. So active listening really helps you to improve your communication and boost collaboration. It helps you truly understand what the other person is saying. So you might paraphrase and say, so if I'm hearing you right, what you're saying is X, Y, Z. Let them confirm that, or you might have misheard them and they can correct you. It does help you connect on a much deeper level. It demonstrates empathy. It's a really good way of resolving conflict, even just paraphrasing what someone just said back. So you can say, so, what you're saying is X, Y, Z, and it allows them to go, that's not what I'm saying. Okay, sorry, what are you trying to say? That's a really good way of making sure you're on the same wavelength and not arguing about two different things. Builds trust and helps you to build rapport as well. And when you look for it, we'll all have experience of where we've seen it work really, really well. And to help you memorize it, this is a nice little active listening worksheet that you can take away and reflect on, because it doesn't come intuitively. Some people do find it easy, but it is something that the majority of us need to work on and make sure that we are deliberately listening. We're not just kind of passively listening or just waiting to talk ourselves. So the key 5 steps to good active listening is remove distractions. So, for example, you might say, do you know what, it's a bit noisy in there. Let's go into a private room and just I want to make sure I can listen to you properly. Using non-verbal cues. So think up, have your hands in your pockets, and obvious things like that. Looking them in the eye, making sure that they can tell you listening. Like I said before, paraphrasing and summarizing. So what you're saying, it sounds like what you're saying is when you don't get any sleep, you find it harder to make healthy decisions the next day. Is that right? Yes. Okay. So where do you want to go from here? Okay, good. Just want to clarify. And reflective listening is very, very similar, but it's just reflecting back the emotions and feelings and just saying things like, so it sounds really tough that it sounds like what you're going through is X, Y, and Z. So kind of similar to a paraphrasing and summarizing, but it's more looking at the kind of emotional side of it as well. And then asking open-ended questions. So, it sounds like you're going through a really tough time, but what do you think will help best with that? That open question lets them fill in the blanks. And there's a really good saying, when you hear yourself speak, you learn what you believe. And often when you just do this, people come up with solutions by themselves. So it's a really good way of helping people understand what they're going through themselves, helping you understand, but also helping them to figure out, this is what I need to do. This is what I'm struggling with. I just know I need to stop having that espresso before bed, or I just know I need to focus on my sleep quality to get better. Or I know I need to get back into exercise because although I felt self-conscious, I did feel much better when I was doing it. Everything was better. Yeah, good idea. It's completely different for everybody. What works for one person won't work for the other. But when it's come from you and you and you decide, I want to do this health habit, then you can't go wrong. And then when they come back in, reflecting and go again. So ultimately, as physios, PTs, massage therapists, what can you do? Listen to and support menopausal women, so actively listening like we just described. You can provide advice and education around the pillars of health, not HRT. We're not trained to do medication, but we can encourage people to speak to a pharmacist and doctor about HRT and adjust the individual's programming and treatment to the individual. So if someone is very hypersensitive, you might choose an exercise. If they go, I don't know, if they had a knee injury, for example, you might choose an exercise that's a little bit easier for them because they're a bit heightened in their sensitivity to pain, for example. And having an understanding of what menopause is, why people get it, how many people get it, is really important for you just to broaden the horizons of the world we live in and what people are going through. Because if you don't understand their problems, you're going to really struggle to help them. And if they don't feel like they can open up to you, it's going to be harder to build rapport and to help them with these health habits. Whereas if you can at least have an understanding of the symptoms they're experiencing and why they're going through it, etc., and the time frames and understanding it is variable, it will just make them feel like they can trust you a lot more. So in conclusion, women are a huge part of our population, our client base, and most health facilities, yet most healthcare facilities are silent on these needs. And very few, in fact, it's been a while since I did my physio qualification, but I still don't think menopause is necessarily taught as part of the curriculum. Certainly not in PT and massage therapy, I don't believe. So that's what CPD is all about. That's why we do the CPD sessions every month. It's about upskilling ourselves and making sure we're always learning. And we need to create menopause-friendly gyms and clinics. Let's level the playing field. The research is non-existent in women's health conditions. But that doesn't mean we can't help people and understand what's going on. And we want to help everybody maximize their quality of life, live their best life. And this is part of that. So we do have a top 6 habits work with menopause. This is around the 4 key pillars of health: movement, nutrition, sleep, and stress. And we've got a QR code here. Use that to go and download yours now. We've also got a 4-day course, which again just helps understand what it is and how to navigate it. So whether you're a personal trainer, physio, massage therapist, or if you're someone who is going through menopause, you'll find this course really useful. And we also have a health pension program for people who want support improving their health habits one-to-one with one of our Health by Science coaches. So for more info, you can check out these key websites. That's where a lot of our information came from. And thank you very much. Keep an eye out for future workshops while we dive into all related topics related to rehab, performance, health and well-being, and weight loss. Cheers.